So if you've been on the last two sessions with us, this is the finale of our series on strategies for revenue cycle success in 2021. And we are going to try to tie together some of the themes we've been hitting on the last 2 weeks around price transparency and charge master pricing, and really trying to tie that together with payer contracting and reimbursement. So just some brief introductions. My name is Brad Josephson. I'm the Director of Marketing here at PMMC. And PMMC is a leading provider of revenue cycle software and services. We have more than 400 hospital clients across the country. And with me today is Greg Kay. Greg is the Senior Vice President of Revenue Strategy at PMMC. Greg has 30 years of experience working with hospitals and health systems on payer contracting and reimbursement strategies. Greg, thank you for joining us today.
Absolutely, Brad. Glad to. And Brad, are you sharing your screen?
I will be shortly. Thanks for catching that for me, Greg.
Certainly.
There we go. Should be live now.
Terrific. Well, we do appreciate everyone. Go ahead, Brad.
Sorry, go ahead, Greg. I was just going to say, we would like this session to be interactive as well. We know that some of these topics going into next year are going to present both new challenges and opportunities, so we definitely encourage you to ask questions throughout. And if you do think of any, go ahead and enter those into the questions tab in your GoToWebinar panel, and we'll have a few minutes at the end for any questions. And then before I turn it over to Greg, we do also have some offers for our attendees that we're going to be sending throughout the session. So you may see your chat message alert light up. It should light up a red or an orange color. So be sure to check that for any messages that we might send throughout the chat. Greg, did you have any other thoughts before we get started?
No, we just definitely welcome everyone being a part of today's session, and look forward to sharing some of the trends that we're seeing in the industry as we go into 2021.
Great. So I would like to ask a poll question to kick off today's session, really around the use of analytics, because that's what we really want to hone in on this afternoon. So the question here is, how effectively are you using analytics today to monitor reimbursement? So the options here, and I'll go ahead and launch this poll. So the options here are very effectively. Analytics helps us identify payer trends and guides our decisions. Somewhat effectively, we use analytics but lack true insight, or not effectively. We either don't use them or they don't help us. So let's give everybody about 20 to 30 seconds to get their votes in. I can see them coming in now, and then we'll go ahead and share those results. Give everybody about 10 seconds to get their votes in. All right, looks like most of the audience has voted. Let's go ahead and share those results now. So most people are in the middle. So 78% of you said somewhat effectively. We're using analytics but lack true insight. Another 11% said very effectively. And then the remaining 11% said not effectively. So Greg, any thoughts there? Any reaction to those responses? Is that kind of where you thought it would land?
Yeah, it is. I think most organizations today do have some type of analytic platform. And, you know, what we're wanting to cover today is some of those key pieces that you should be looking at or key adjustments that you should be making with your current analytical platform to really make sure you're capturing all the right data elements to truly help drive that insight, which is going to be even more important as we go into 2021. So one of the ways that we help our clients in that navigation process and really leveraging analytics is what we refer to as a revenue maturity matrix. And as the poll question noted, it really is that insight around reimbursement and determining and incorporating and building, if you will, a reimbursement strategy. And obviously, a strategy does follow a building block process. And typically, we found over time that as your process, as your strategy matures, you climb and improve with your strategy. Our approach, especially with analytics, really does start with an accurate contract governance process. So when we start talking about analytics, it's a foundational principle, if you will, that the data behind your analytical tool, your platform, is built on an accurate process so that when you bill for services, you know what you're going to be paid, you know what that expected reimbursement is, you're auditing back to that process, and you're collecting all that you're contractually due. And then really that becomes more relevant in the payer negotiation process as you're doing prospective contract modeling, as you're adjusting your charges through your annual strategic pricing work. And really that leads into more situation enablement steps like the upcoming price transparency mandate. And this becomes more relevant out into the marketplace and really how we leverage analytics and that reimbursement strategy to take into account, to find those areas of opportunity to build competitive advantage. And really with price transparency, that's going to become more relevant in terms of how we're engaging with our patients. And ultimately, this all leads to a more long-term strategy, if you will, around value-based contracting. So as we go through this, just keep in mind, this is our lens, if you will, when we start looking at and working with clients on how to build out your reimbursement strategy. It does follow a specific stair-step approach in the process. Now, in our first session that we did, as Brad noted, this is the third part today of a three-part series that we've been conducting. The first part, we really looked at and reviewed the requirements associated with the new standard charge and machine-readable file, the two approaches as it relates to the 300 shoppable items that all hospitals are going to have posted on 1/1. And we really went beyond not just how are you going to meet the mandate, but what are you going to do to capture and utilize the new market data that was going to be coming available. The second session that we did last week, we really dove into and discussed how this new data can be utilized and how we need to rethink the relationship between charges, pricing, if you will, both gross and discount pricing, and our payer contracts or that negotiated charge. So today, we're going to be looking at sort of the component that ties contracts, pricing, and charges all together, and that's the analytics. And we're going to look at some specific example reports that should be incorporated into the process. And it's also important to note that you really do need to look at some of the changes that are taking place as we go into 2021, that all team members are really working from the same analytic platform. And that would be your managed care department, your marketing department, or business development, if you will, revenue integrity, or the revenue cycle area, and your CDM team, because these three components, pricing, contracts, and charges, really impact those three areas. And instead of really operating as historical silos, where the CDM team would set charges, the managed care team would negotiate discounts off of those set charges by another department, and revenue integrity would have to audit those two pieces. It really does all come together, and it has to operate as an integrated pyramid, if you will, so that one piece is built on the other. So as we kind of wrap up, here we are in November 2020. One of the big issues that has hit us this year was the impact of COVID. And today's session really is an extension of what we presented at the NARI virtual conference a couple of weeks ago. And at the time, we really weren't seeing the uptick that we're experiencing today in many markets and where many of you may be. At the time, the question was really what was the revenue fallout, assuming we were not going to have any more fallout. And while there is a vaccine that has been announced this week, we could still be a few quarters away before that really starting to have an impact, especially if we do see a second wave or a third wave, depending on how you're counting, additional revenue fallout. So it's important to note that, and it's also important to note, how do we really project the return of elective procedures? You guys, some of you may already be there, others you may be in that curve of elective procedures coming back. And we also have to think about, with this next wave, how is that potentially going to impact our elective procedures on a go-forward basis, because that really does drive, for most hospitals, our bottom line and our revenue. So with many organizations, the significant fallout did occur, and most, as I mentioned a moment ago, have seen a pretty significant return to normal levels, if you will. Really, the end of Q1 and all of Q2 was quite catastrophic for all hospitals. But the question now is, will it continue? Will there be a surge that takes us back to those May-June levels? And really, how will the vaccine and the clinical drugs may affect this trend as we go forward? Obviously, it's going to be slightly different from marketplace to marketplace. And this really does lead to more planning, if you will, around what the comeback process is really going to look like. What's likely to come back first, especially if there is an uptick, really how that change may be occurring, especially when we start to think about the vaccine and how that impact may impact us and each individual marketplace in terms of the demographics around who's likely to go first, the over 65 group first. This is going to tie back also into pricing and how we may be looking to price our services, both with the upcoming mandate, what services are online as services do come back to more normal levels. How are we with shoppable services? Are our consumers really going to be looking at pricing our services more? And really, what are you seeing and what are you taking into account in terms of your mix of services? Are you getting back to previous levels? And if you aren't, how are you analyzing competitor data to really understand what their mix may be like, and are you losing services to other areas? This is going to be a real critical piece as we go forward in the marketplace. So going into 2021, we really are going to have to begin thinking about and incorporating new analytics around pricing, both how our prices are set, how they're displayed, price elasticity, how shopping may be taken into account, and what services may actually be shopped. Consumers over the last 6 months, as we know, that they've changed their buying habits. Online shopping did occur prior to this year, but nothing like the extent that we're seeing today. Online school has become more of a norm in many areas. Online work has also become more of a new norm. And so from a volume perspective, it's important to look at what's changed within your service lines from 2019 to 2020, and then across 2020. How has that changed by quarter? Where are trends leading, and what are you discovering with those trends? And really, why are those trends occurring, especially as we start to consider what is being shopped as we go into Q1, as we have either online tools at our individual hospitals or our competitors may be deploying online tools. We have to take that into account. It's also important to note that there are some data sets out there. One of the ones that we use is the Medicare Standard Analytic File to really help better understand not just how your gross charges compare, but really how does your mix compare. The Medicare Standard Analytic File typically has about a 2-quarter lag. Much of that data really now is about 3 to 5 months behind. So we're starting to have access to data from second quarter, so we can look at both our first quarter trends, our second quarter trends, to really understand where volume was, where volume went, and how it may be changing within service line areas. Now, our industry has historically used, and we've monitored and adjusted charges over the years based upon what many would refer to as retail charges or gross charges. And that's the upper left-hand report example here. And with gross charges, we typically use gross charges as being our price guardrail. Obviously, we didn't want to be too high. We didn't want to be too low because it didn't make financial sense either. But after January 1st, hospitals will have to post your negotiated charges or your base rates. And a key question from an insight standpoint is going to be, how are you going to first gather that data from your competitive hospitals, and then how are you going to analyze and model those competitive base rates to really determine how your rates really compare and how your rates can be modeled out with your full payment methodology, and how do you incorporate the base rates from your competitors with your payment methodologies to really understand, if you will, are my current contracts a fair contract, a good contract, or a great contract based upon my previous negotiation? In other words, how do we incorporate something like that online shopping experience when we go to buy a car? There are tools out there like Car Guru that allow us to quickly see and understand, hey, is this a good deal or a great deal, or maybe it's just a fair deal? We need to start to really think through, and it gets at that root insight piece of how our rates compare in the marketplace as this new data becomes available.
Yeah, and Greg, if I could just jump in and just interject a point, something that came up as a discussion here internally was, and I'm just going to go back to this analytics slide here. I think that this is interesting here, are shoppable services driving patient volume? So in other words, are you promoting those services in a way when it comes around to January 1st? Is your organization promoting those services in a way that's helping to drive scheduling and volume? I just thought that was an interesting correlation to start looking at. It might not be as relevant now because that data isn't out there yet. And I think we're going to start seeing more price estimate tools go live January 1st. But I just wanted to point that out, that I think that's going to be something really interesting to look at in 2021.
Yeah, it's a great point, Brad, because that really is a mindset change. The data itself is probably being tracked by most organizations in your analytic platform. And if you're not tracking this, it really is going to be a key piece that you're going to need to have going forward. But it's not just tracking the graph and seeing what the activity is, but it's having that mindset and converting that data into, how do I strategically make changes? How do I promote certain services that's going to be different. I mean, it's going to have to change the mindset to really get to a point where we're deriving insight from the data that may already readily be available. Great point. So the other piece to keep in mind is that telemedicine has also become a new norm in fairly short order. The pandemic has introduced telehealth to literally millions of patients. And here we can see some of the trends that did take place in terms of office visits and a significant decline. In March, telemedicine, telehealth visits significantly increasing. And we can see that the new norm, if you will, has adjusted on a go-forward basis with office visits being down, telemedicine visits being up. And we have to really look at and consider what the new norm is going to be, because obviously there's been about a 20% move after the initial spike that did occur back in the March, April, May timeframe. It's important to dig deeper into where you are using telehealth and really determine the volume that you're seeing versus reimbursement and the reimbursement impact on on-site visits. And this will really help you determine where you want to be with your future contracts. And Brad, in the next slide, we really kind of lay out some key questions that need to be incorporated and what the impact is going to be for your organization. Obviously, new transparency data will help in determining volumes and reimbursement success at competitor hospitals, but there's some basic questions that every hospital should be looking at and incorporating as you've seen these spikes and changes, especially if you're billing for clinic services, professional services. You've got data today. We know Medicare is paying for telemedicine on existing patients, but we really do have to look at kind of that negotiated rate as we shift that over to our commercial payers. And this is where analytics can really help you create those actionable items to know where and how to incorporate that into the modeling process. Okay, Brad. So we've touched on a few trends, being the impact of COVID and telemedicine, and those have definitely had impacts on our revenue cycle this year for all hospitals. And we really wanted to wrap up today's discussion with some specific analytical reports and processes that will become more critical here as we go into 2021. Now, I think it's important to just note more first and kind of foremost that today's payer contracts that were historically negotiated, put in a drawer, filed away, put in a binder, they were set aside, if you will. As we go forward with the new mandate, those payer contracts are really going to be an underlying fundamental component. So it's going to be important that your payer contract base rates are accurate. That information will lead to more accurate payer scorecards, the reporting that you guys put up. So accuracy truly is a baseline when we start talking about analytics. So it's not just useful visual data, but you've got to have the drill down capability. You've got to have the latitude to have all the information that you need readily available from an analytical standpoint. So this first report is something that we're finding most organizations did not have ready access to. There was an assumption on CMS's part when they required all hospitals to list their base rates. Most organizations did not have that as a file, if you will. And so price transparency is going to raise the bar, not only on how you negotiate your base rates, but it really is going to raise the bar on how you track and you report your payer negotiated rate. So for the machine readable file that's going to be out there, you're going to need to post this information. It's going to need to be accurate for all contracts and all items and services. And this is really going to be the case for not just inpatient services by DRG, but it's also going to be the case for outpatient services. And historically, we as an industry have billed our charges after we negotiated reimbursement. And so we allowed the payers to compute the allowable, and providers, we would audit that reimbursement for accuracy. Going forward, and as you can see on the next slide, we're going to need this information for both inpatient and outpatient services to not just have available for audit purposes, but we're also going to have that information available for reporting purposes, patient estimate purposes, pricing purposes, and we're going to have this data more readily available as we're setting charges, adjusting charges, and negotiating our payer contracts. Base rate information is going to become more public, and you will need better contract repositories, if you will, something other than a folder or a contract book for storing and accessing this information in really a real-time fashion. The other piece to keep in mind, and every hospital today has some methodology, and that's payer scorecards. And payer scorecards really, again, it kind of ties back to that first and foremost, it goes without saying, but the accuracy of your data for your analytic tool is going to drive the accuracy of your payer scorecards. But scorecards are going to become an even more important anchor to your revenue cycle process when using analytics, especially if you're wanting to optimize your revenue cycle management process. Dynamic scorecards allow you to compare one payer against another, as you can see here. But you also have to have that drill down capability to understand quickly what's taking place to gain insight. Here we can see in the chart, the bar chart on the left-hand side, our patient portion piece is higher with United than the other payers. So we would want the ability to quickly drill into the service line area to explore what may be taking place. And on the next screen, we can see from that scorecard standpoint, the opportunity by service line really is showing that with United, and really across the board by service line, that area patient portion is largest in the orthopedic area. So we're going to have that ability to quickly drill down to see where it's occurring so that we can, from an insight standpoint, look at changing processes, changing procedures, incorporating new steps to really drive change in our organization. And that change could be in those orthopedic areas. How are we addressing that patient experience? How are we engaging with the patient upfront? How are we pushing for payment plans, upfront collections? How frequently are patients shopping for those services and really understanding their financial responsibility? So as we kind of take a deeper dive from the service line into our patient scorecard, which would be another area report that everyone should be using more and more as we go into 2021, you're going to have to really understand the locality of your patient mix, the percent of shift of risk, if you will, from the payer to the patient. That's going to become a more important driving issue, I think, for all hospitals, both in terms of just managing bad debt, but really managing that whole revenue stream with the patient. And understanding where your patient mix is geographically located really helps you by payer understand how to better message, how to better target, and how to interact with your patients especially those that may be changing or shifting to high deductible plans that you may or may not be necessarily aware of. It's also important to note from a modeling standpoint how that patient portion is going to impact your future payer contracts. It's important to take into account those real world scenarios, so to speak, so that we're accounting for the risk involved with that patient liability and the commercial payers' underpayments when we're modeling and negotiating and taking into account not only trying to move your contracts to be in line with the base rates for other organizations, but when I start to apply my service mix and my population, how does that contract really look as we get into those negotiations? We're going to have to model that and really factor into that net revenue impact so that we're getting that true real world view of your models and the future potential impact versus sort of the ideal view that we may have used in the past. Obviously, with COVID-19 and the changes that we've seen with cancellations and delays in elective procedures, it's going to be important to factor this into our modeling trends as we go forward. We're going to have to take into account what it would look like if I increase my charges on elective procedures while decreasing charges in other areas. Can I make up some of that shortcoming by charge or reimbursement adjustments? What really is the right price elasticity as I go into those negotiations? So as we wrap up 2020, a couple of key takeaways from today's session is really kind of how is the rebound going to look, really understanding that service line impact and how the mix can change, and have we lost services to competitors as we start to see the rebound occur. The same thing with telemedicine. What's that rebound going to look like as we model out changes and shifts in reimbursement as more things may move to a telemedicine part, especially if we're operating as an integrated health delivery network. What's that shift taking place with our physician market, and how are we seeing an impact, and how do we want to account for that in our future payer negotiations? And then lastly, how do we leverage analytics to take all this into account, really going back and evaluating our current scorecards and looking at and ensuring, are we capturing all the data elements that are available today and those data elements that are going to be available as we go into 2021, knowing that there's going to be more information posted and available online after January 1st. Brad, any additional wrap-up thoughts?
Yeah, I just wanted to make one more point that we did send out some chats throughout the session. Some of you might have seen that already, but if you didn't, go ahead and check your chat alert. There should be an offer in there. So go ahead and respond if that looks like it would be of interest to you. I just wanted to make that point. And then we will open it up for any questions. I know we're running a little bit over, but I still do see some people on the call. We're happy to take any questions you have from today's presentation before we wrap up. Well, I don't see any questions that came through. Greg, did you have any closing thoughts? Anything we didn't cover today that you wanted to touch on?
No, I'll just wrap up by saying that we do appreciate the opportunity to work with all of those organizations that are on the call today. We look forward to working with everyone more in 2021, both in terms of current clients and maybe even those prospective clients. 2021, I think, will just build on the challenges that we've experienced here in 2020. I think there will still be ample challenges ahead of us. The key is going to be, how do we learn from what we've seen and experienced? How do we incorporate that into not just analytics, but how do we change the way we think about the data to really drive new insight from that information going forward. So we certainly look forward to working with you to take that middle group, that 78% of those that were on the call today, to push you up to that next level where you're getting not just data analytics, but you really are gaining insight from what the data tells you as we go forward in the new year.
Yeah, I agree with all that, Greg. Well said. Thank you. And I will close out. Greg is going to be back next Thursday. So we are doing a joint presentation with HealthPay 24, and we're really going to be kind of honing in on the price transparency and consumerism concept that we're looking forward to next year. So the mandate is going into effect January 1st. I'm sure many of you are in the middle of that or wrapping that up. And so we're going to be talking about what really the patient experience could and should look like in 2021. We're sending that registration link out right now. So we encourage you to join us next Thursday at 2 p.m. for that session as well.
Brad, thank you again for hosting today's session. And we hope everyone has a terrific rest of the day and the rest of the week.
Thanks, Greg. Thank you, everyone, for attending.